in place. We will now discuss some generic principles to help guide you in choosing specific fluid delivery rates and types of fluid. Again, we will first consider fluid resuscitation scenarios, then maintenance fluid regimes. In fluid resuscitation, fluid is being given to correct an existing fluid deficit, and large volumes of fluids over short timescales may be required, depending on the patient's status. Always assess the patient fully first. Low blood pressure, tachycardia, and low urine output are classic signs of hypovolemia. Consider administering fluid boluses in volumes of about 500 millilitres to adults requiring fluid resuscitation and reassess after each bolus. For elderly patients or those with cardiac problems, proceed more cautiously by using smaller boluses of about 250 millilitres before reassessing to avoid fluid overload. The initial fluid of choice for resuscitation is typically normal saline. Ensure that bloods are sent to the lab promptly, as these, along with the patient's clinical state, will be key to guiding further fluid choice. An important point to note is that potassium cannot be given quickly due to its potential harmful effects on the heart. Your local trust guidelines will advise you on the maximum rate of potassium delivery, but it's typically around 10 millimoles per hour. Normal saline with 20 or 40 millimoles of potassium chloride added are therefore not typically used in acute resuscitation scenarios and must be administered via a pump so that the rate can be set accurately. Maintenance fluids are used to replace ongoing fluid losses in patients unable to maintain adequate oral intake. There are specific formulae for estimating the maintenance fluid requirements based on patient weight. A typical adult of about 60 to 70 kilograms will require approximately 100 millilitres per hour, i.e. 2.4 litres over 24 hours, to maintain hydration. The patient will require more if there are ongoing additional losses such as vomiting, diarrhea, or increased stoma output. Throughout the period of intravenous fluid replacement, blood electrolytes should be regularly checked and the type of fluid administered varied accordingly. When planning the fluid regime, remember that adults require about 2 millimoles of sodium per kilogram and about 1 millimole of potassium per kilogram every 24 hours. A typical fluid regime may consist of alternating bags of normal saline with or without potassium chloride, 5% dextrose and Hartmann solution. In this video, we have discussed fluid therapy in the context of resuscitation and maintenance scenarios and have considered fluid choice and rate of delivery. There are a few final points to note. Firstly, throughout the period of fluid replacement, you should be monitoring the patient's clinical status and blood electrolyte values. Regularly review whether your patient continues to need intravenous fluids and stop them as soon as the patient is able to maintain adequate hydration enterally. Finally, this video focuses purely on adult fluid therapy. Pediatric patients require much stricter protocols which are not covered here. Always seek senior advice when prescribing fluids